Thanks very much, everybody, and thanks for waiting. We are halfway through our month of measures to curb the spread of COVID-19 across our communities, and today in the Executive we have considered the impact of the tighter restrictions on infection rates. And it's fair to say there are green shoots of hope, and as the Health Minister outlined earlier in the week, the North West area has seen an encouraging decrease of over 50% in positive cases. In fact, right across Northern Ireland, we are seeing a steadying of the number of people who have been diagnosed with the virus. The medical and scientific advice is that the R rate for case numbers has dropped below 1 for the first time since the early summer, and indeed it is below 1 in 10 of our 11 council areas. And whilst this is good news, we have still more work to do. And very sadly, we are seeing the heartbreaking news that over this last week, the numbers of those who have died has risen by 47. And our thoughts and prayers are with you, and indeed with every family that has been touched by this brutal and unrelenting virus. We are all in this together, and there is evidence of the impact of the restrictions being observed. From publicly available data compared with a baseline from January and February of this year, activity with the current restrictions has decreased significantly up to October 20th across a range of areas. Public transport usage is down by 49% in Northern Ireland, recreation and retail by 33%, workplaces by 41%, and park visitors by 26%, all lower than the UK-wide picture. Supermarket and pharmacy activity is also down by 8%. And the Executive is committed to supporting all of those who are experiencing difficult times during this pandemic. Today, we have put in place a package of around £687 million to support people, jobs, education, and of course our health service. This includes around £61 million for supporting the continued safe education of our children and young people, an additional funding of £7.3 million for our local hospices and cancer fund for children. Up to £25 million will be made available for 2 new support packages for taxi drivers and private bus or coach operators. £6.5 million for a blend of community initiatives to support those in need. And we are committing around £500 million to the health service. We have discussed additional support for dealing with the current surge, our health service capacity, test and trace arrangements, and indeed progress on a new rapid testing. We considered the stepping up of ICU beds at the City Hospital Tower Block and elsewhere, and raised the available workforce with the Health Minister and whether there is scope to expand beyond the pool available to us. We do recognise, of course, that highly skilled anaesthetists and ICU nurses are relatively finite. However, we are hearing of simpler issues where we might be able to help spread the load and make the system more efficient, such as in cleaning and preparing ambulances for turnaround. So we are immensely grateful for the efforts being made across our health and care services, and the number of staff off work is actually lower than it was last week. The Health Minister updated us that around 4,500 staff are currently off work, but 3/4 of those are with what would be considered standard sickness for this time of year, and the absence of approximately 1,100 staff is COVID-related. So that's equivalent to 1.6% of the workforce, which is in keeping with our first surge in the spring of this year. We were also advised that 10% of the 2,700 people who have responded to the workforce appeal have already been appointed or their appointment is imminent. Officials in our civil contingency group are meeting again on a regular basis. So as I've said before, we're now living with the reality of COVID-19. But we have learned a lot over this past 7 months. We know more about how it is operating in our community and the many ways we can keep each other safe. The Stop COVID-19 app is a very good example of this. That is proving to be a very powerful tool in identification and tracking of cases, and it now has interoperability with Scotland and Jersey, as well as the Republic of Ireland, and we're hoping that England and Wales will follow soon. Our local teams are to be commended for their innovative and groundbreaking work, and I would urge everyone to download the app if they haven't already done so, because we must redouble our efforts. This weekend we have Halloween, and while we would like all those who are young, and indeed young at heart, to fully enjoy themselves, we would ask that you do so safely and in line with the public health guidance. Of course, on Monday our schools will reopen after their short break, and the Education Minister updated the Executive on measures to mitigate against schools-related spread of the virus. Whilst rates of transmission are low in school, it is the activity and mingling outside of school, for example, at school gates, that is of particular concern, and messaging will be rolled out on that issue over the coming days. The Executive has also agreed today that face coverings will be mandatory for all post-primary school children on dedicated home-to-school public transport, and exemptions will apply, for example, of course, with those who have special educational needs or indeed other relevant disabilities. So we are seeing positive signs that our efforts are having an effect on the virus. We have 2 more weeks to go in these current restrictions, so we have a lot to gain, and I'm asking people not to slip back, but actually to stay safe and to save lives.